जी, अस्सलाम वालेकुम। आवाज़ आ रही है आपको?
अस्सलाम वालेकुम सलाम। एक तो मैं इससे पहले माफी चाहता हूँ तमाम लोगों से, क्योंकि आज हम सैंडविच हो गए दो वेबिनार। पिछली वेबिनार खत्म करने में उसमें बड़े फॉरेन पैनलिस्ट थे, बहुत लोग थे, तो बड़ा टाइम लग गया। लेकिन बहरहाल रबिया के मुझे मुस्तकिल मैसेज आते थे, आई वाज वेरी वरीड, तो तरीका हो कि इशू हो जाए टाइम के ऊपर। चलिए रबिया, थैंक यू वेरी मच। अब आप देख कितने पैनलिस्ट आ चुके हैं आपके? रबिया, कैन यू हियर मी? अभी आपकी को
Yes,
आवाज
sir.
में जी जी हुमा चौधरी आ गई हैं, वकार साहब आ गए हैं, जबरदस्त फैसल वजूद है। मेरा ख्याल है अल्लाह का नाम लेके आप काम शुरू करें अपना, मेरा ख्याल है।
Yes, sir. We will take Miss Puma Chaudhary and Dr. Vakar first because Miss Puma Chaudhary is from Australia. वहाँ पे भी काफी late timing है और
अगर
Dr.
आप
Vakar
अगर आप इजाजत दें तो शुरू किया जाए रबिया, शुरू किया जाए।
Yes, sir.
ओके, बस ठीक है। जस्ट गिव मी 1 मिनट। राइट जी, अल्लाह के पाक नाम में शुरू करते हैं जो बहुत रहमान और रहीम है। अल्लाह ताला हम सबको महफूज रखे जहाँ जहाँ भी हम हैं। And thank you much, especially the foreign panelists. Especially, I would like to thank Huma for being with us so late in the night. I can imagine about that. Huma, again, my challenge to you, I did last time, that you are free to leave us after your talk because it's very late in Australia. But it will our endeavor to keep you with. So I think it's thank you very much. And this is a very important webinar today. It addresses something which is very vital for all of us, that is health. And linking artificial intelligence with health, I think, is something very amazing for me. Basically, I am a technical person. I understand very basis of artificial intelligence, but this much is very, very clear to me that AI is going to play a very vital role into health sciences. And very esteemed panelists are sitting here. They are the expert in their domains. And this is very, very encouraging for us because today we have invited some people from academia in Pakistan, and they'll be listening to your talks. And the use of artificial intelligence is, I think, stretching over to every domain of our life. But in the health sciences, they are doing amazing works, amazing works. And I think there are new innovations, there are new ventures in which we are going to. It's the business, it's the business for the doctors, business for the hospitals, business of everybody around. So I think COVID-19 has just accelerated the process. It was already there. The understanding of technologies in the health sciences already there. We started somewhere from e-health. Today we are talking about digital health. So it was already there. So now the COVID-19 has just pushed a button, and now it's in a very, very fast track. I think the challenge before all of us to understand this change paradigm and to respond proactively. You know, you can't stop time and technology. The people after 3 years, people after 5 years will be different doctors. To my understanding, I don't know, it's imagination or not. In the Blue Area Islamabad, there will be 2 shops. One is Dr. Uzma sitting. Second is Dr. Robot sitting. And people will prefer to go Dr. Robot because doctor, just put your hand there, it will record all your medical vehicles, see all your history, blah, blah, and give you, okay, get the medicine. So I don't know how it's going to happen, but even today, if you see the remote surgeries there, I think you all know all these things much better than me. So the doctor in Orlando doing surgery, someone in Canada, so it's already there. Robotic surgery is there. I think there have been a lot of innovations, but now when we apply AI, you know, I think Dr. Kumar will talk more on this. It's not my subject. When you apply data analytics, I think you make a small data sets based on your own understanding of things. And when you have a big data, you know, now we are generating data. Amna, welcome. Amna Malik is here. She is the first e-woman in Pakistan working with us for the last so many years. Amna, welcome. And she has a passion for e-health services. So what I'm trying to say is that when you have a big data, and when I talk about data, it's very amazing that we were in the process of generating the traditional data, but now we are generating unstructured data. Data is coming from sensors, data is coming from air conditioners, we have IoT based. So data is coming from everywhere. And I think this data will give us a lead to understand the AI for health. So with this brief introduction, I hand it over to Rabia for take the bus further. I thank you again. Thank you again, especially panelists from Australia, from Canada, from other places. I know it's not a good time there. And Uma, I'm especially thankful to you that you are sitting here so late. Thank you. You're always very kind to me. Over to you. Over to you, please.
Thank you, Sir Ammar. I welcome you all in AI Week, second day. The topic of today is AI
I
for
think
health.
you can take over because Rabia is having some technical problem, voice problem. You can take over. You can invite the next panelist.
Okay, sir. I will invite first Ms. Homa. Ms. Homa.
Nafis, can you hear
Please
me?
your turn.
Okay.
Yeah, I will. जी सर
yeah.
मुझे आवाज
Okay. I think Huma, you're going to take a start.
Yeah.
I think.
Yes, okay, but I can't share.
Why we are not?
It says, can you, if you go to
It's a
security,
sound
then
problem with me or
Yeah,
everybody?
it's okay now.
all
Please share
right.
now.
Thank you. Perfect.
Yeah.
So I just created this brief presentation for today. A very small slide to make sure I don't bore you enough. I am a founder of Feel AI. In Feel AI, we work for artificial intelligence and see the impact and implications of artificial intelligence in our daily lives. So my name is Homa, and I'll take you briefly through how artificial intelligence different domains is affecting health. So let's start with the first one, which is artificial intelligence from the subdomain of machine learning for neural health. So we know that the EEG signals from the brain are used to study neural activity. And currently, people are doing research and there are many active groups to study the neural activity to understand whether there is probability of creating Alzheimer's in the future in their adult age. Also, they're studying the neural activity to understand if there is a chance of developing epilepsy or if the patient is likely to have epilepsy in a few hours and so on. So you can predict epilepsy. This happens using the information of alpha, beta, and other information signals from the EEG, just EEG signals. So this is happening already. So these are very interesting applications using for neural health, artificial intelligence for neural health. The second domain that is active is artificial intelligence with the subdomain of natural language processing for healthcare systems. So this is from Davenport. He has mentioned that in healthcare, the dominant application of natural language processing involves the creation, understanding, and classification of clinical documentation. So we all know that the clinical documentation is a very big challenge. It's everywhere, and sometimes you don't even know how to get it together. So natural language processing, the language that is written by the doctor, by the pharmacist, by anyone who is in the healthcare system, how to use that information to make the system automate and to make the system understand what is written in those what is written inside that, and to automate the systems using the natural language processing. The third thing is, like Mr. Ammar mentioned, that AI robotics. So how are robotics helping people to solve critical surgeries? And so there is a surgical robot. Initially, it was approved in the USA in 2000, and it provided superpowers to surgeons. Now, superpowers does not mean they became Supermans or superwomen and they started flying, but actually it gave them a vision that they didn't have. Humans are likely, they have a tendency to get out of focus. They might not be able to understand the contrast. So you can do image enhancement using computer vision techniques. You can highlight the brain tumors inside their MRI scans. And that is how a new vision is being given to the AI robotics to perform surgeries and to help the doctors better assess and detect this kind of information, such as cancerous cells using the blood image and so on. So another thing is Now, AI for patient engagement. This is very interesting. So the more patients proactively participate in their own well-being, the better is the care. So the patient has to proactively care for themselves before you can make them take help. So they should want help. They should be proactively looking for help, and then you can help them. So to do that, we can understand for example, did they move today? Did they walk today? And have they checked in with the doctor? Have they had their medicines and so on? So this is how you can make the patients proactively participate for their well-being. And doing that automatically improves the patient's health. So there are so many ways of creating or creating chances for patient engagement for artificial intelligence. And the last thing these are some of the examples of where AI is contributing towards health. The last thing I'd like to mention is that there are some challenges. We are very excited and by the artificial intelligence everywhere, but even currently, some systems have come, such as Watson's IBM came for medical treatments, but it got backline because it was an overly ambitious project. And we might assume that tomorrow or in a few days, the robot will be standing and doing their surgeries and so on. But we need to remember that the data has to come from people. The data has to come from procedures. Artificial intelligence is hugely dependent on big data and data. So now that begets a question of another challenge, which is ethical implications. Do the patients want to, or are they volunteering for information? And how much information do they want to share? So these are some of the challenges when you work on artificial intelligence and health. All right, so with that, I'll conclude by saying that we are looking at artificial intelligence making a very positive impact on health, but it comes with its challenges, especially the ethical implications. So thank you so much. That's all for me.
Dr. Ammar, I know it's very late in Australia and you may leave us soon. So my very quick question to you is that in Pakistan, I think you're from Pakistan and you know this very well, we are having a serious problem in having a centralized health system. A person in Karachi, when he goes to Islamabad, when he goes to Peshawar, when he goes to other part of the country, doesn't have. So can you help us and guide us any basic baseline information from where we can start? Amna Malik and we were discussing about the bigger picture the other day. We were thinking about this basic information. You know, when we think about applying AI, it is data driven. You know much better than us. So where would you suggest us to start as a baseline information for collecting the data about health?
For collecting the data, I think we start from the micro level, which is digitize all the clinics. So अगर कोई आया है, उसने आके अपना ब्लड प्रेशर चेक कराया, उसने आके अपना ब्लड टेस्ट करवाया, यूरिन टेस्ट कराया, तो पहली बात ये कि उसके जो डेटा है वो आपकी हैंड रिटन फाइल्स में नहीं होना चाहिए, अब वो कंप्यूटर पे होना चाहिए, पहली बात ये. तो डिजिटाइजिंग द क्लिनिक्स, चाहे वो किसी भी लेवल पे हो, और चाहे वो कस्बे में हो, चाहे वो शहर में हो, पहली बात है कि वहां से डेटा उठाएं और उसको डिजिटाइज करें. उसके बाद बाकी चैलेंज आते हैं, जो कि है कि इंटरकनेक्टिविटी कैसे होगी, और उसके लिए फिर जाहिर है सिस्टम्स बन सकते हैं. अगर we can have NADRA, which is a world class service that Pakistan offers, we can have the healthcare system which is centralized. So ये है, मेरा ये ख्याल है कि अगर आप लोकल लेवल पे, क्लिनिक लेवल पे बात शुरू करें.
डॉक्टर साहब, फॉर द बेनिफिट ऑफ लिसनर्स, मैं आपसे सवाल करना चाहूँगा. अब जो डाटा अनस्ट्रक्चर्ड है, जो डॉक्यूमेंट्स के ऊपर है, उसको भी AI कैप्चर कर. आपको पता है कि वो जो टॉपिक एनालिटिक्स पे चली गई है, तो अगर इज इट पॉसिबल कि आप हमें कोई ऐसी टेक्नोलॉजी सजेस्ट करें जिसको हम यहाँ पे आमना मलिक साहब बैठी है, मुझसे मिलकर अप्लाई कर सके, जो डॉक्टर्स हमारे प्रिस्क्रिप्शन लिख रहे हैं वो डायरेक्ट चली जाए सिस्टम के अंदर, या स्टार्ट के अंदर हम उन्हें कोई ऐसी iPad टाइप चीज डिवाइस दे दें शुरू के अंदर कि वो बजाय प्रिस्क्रिप्शन हाथ से लिखने के वो उस पर लिखें. देखिए, डाटा कलेक्शन बहुत बड़ा चैलेंज है सर हमारे पास. अगर कोई क्विक तरीका हो, और मैं चाहूंगा कि इसके ऊपर एक और वेबिनार की जाए AI फॉर हेल्थ के ऊपर. हमारे इश्यूज दो हैं, एजुकेशन और हेल्थ. अगर ये हमारे मसले खत्म हो गए तो हमारा तो 80% मसला खत्म हो जाएगा. तो पहले इस पर रोशनी डालें डायरेक्ट हम जो डॉक्यूमेंट जिस पे डॉक्टर नुस्खा लिख रहा है अपना, वो हम डायरेक्ट दे दें एआई को, या कोई ऐसी डिवाइस हो, सस्ती हो नेचुरली वो, जो मैं आमना मलिक से रिक्वेस्ट करूंगा कि इनकी जो सुबोधा रेंज है उसमें दे दें 100 डॉक्टर्स को, वो जब लिखे तो वो जब सेंड करें तो वो सिस्टम में चली जाए, और एक चीज उसकी इस पे गारंटी को बात करना चाहेंगे।
ये बहुत अच्छी चीज़ है, और मेरा ख्याल है कि हमारी जो यूनिवर्सिटीज़ है पाकिस्तान में खासतौर पर उनको इसके ऊपर काम करना चाहिए ताकि वो ऐसी डिवाइस बनाए, क्योंकि आपको पता है खुशखती तो इतनी होती नहीं डॉक्टर्स के भी या हमारी किसी के भी एनी मोर, तो उसमें ये है कि हर एक का लिखने का तरीका और होता है, तो इसके ऊपर बड़ी रिसर्च होने की ज़रूरत है कि जब पाकिस्तानी डॉक्टर इंग्लिश में लिखेगा तो वो कैसे लिखेगा, और उसके अलावा ये कि जब वो उर्दू में लिखेगा तो वो भी कैसे लिखेगा। तो पहली बात तो ये कि इस पर रिसर्च होने की जरूरत है। दूसरी बात ये कि अभी बहुत से मेरे पास ये नोट 10 है, इसके अंदर मैं अगर स्टाइलिश से लिखूं कि मैंने जो भी बात लिखी है तो वो उसको कन्वर्ट कर देता है कैरेक्टर्स के अंदर। तो एक ये तरीका है कि रोमन उर्दू में आ सकती हैं चीज़ें, विच वही बात है कि फिर हमारी उर्दू कहाँ जाएगी, लेकिन ये है कि अगर आपने डॉक्टर ने लिख दिया नुस्खा, तो एक ये तरीका हो सकता है कि फार्मेसी के पास जो नुस्खा जाए तो फार्मेसी के पास जैसे OCR है, ऑप्टिकल कैरेक्टर रिकग्निशन, तो वो क्या कह रहे हैं कि वो हमारी लिखी उर्दू या इंग्लिश को कन्वर्ट करे टेक्स्ट डिजिटाइज्ड उसके अंदर, और फिर वो डेटा सेव हो जाएगा तो फाइल में आ जाएगा। तो ऑप्टिकल कैरेक्टर रिकग्निशन के लिए आपने क्या करना है, आपने सिर्फ डॉक्यूमेंट की तस्वीर उतारनी है। तो अगर आप एक वर्ड कराते हैं अपने स्टूडेंट से कि एक डॉक्यूमेंट तस्वीर उतारनी है उसकी, तो डॉक्यूमेंट से जब तस्वीर उतरेगी तो डॉक्यूमेंट खुद ही सॉफ्टवेयर जो है वो उस तस्वीर को का जो सारा टेक्स्ट लिखा है अपने हाथ से उसको डिजिटल, और फिर जो है वो चीज़ जो है आप वेरिफिकेशन है वो आ गई आपको सिस्टम के अंदर, इस तरह से डॉक्टर का नाम भी आ जाएगा, उसकी स्टैंप लगी होगी जाहिर है उसके ऊपर प्रिस्क्रिप्शन के ऊपर, तो वो भी आ जाएगी। इसमें डेटा इकट्ठा हो सकता है, देयर इज अ पॉसिबिलिटी ऑफ डूइंग दैट, लेकिन ये कि मेरा ख्याल है कि हमें अपनी चीज़ों के लिए खुद ही कुछ बनाना पड़ेगा। आई थिंक वी हैव टू बी सेल्फ सफिशिएंट इन।
डॉक्टर साहब अगर इसमें हम फार्मास्यूटिकल को इन्वॉल्व करें, अगर आप अगर हम इनमें इन्वॉल्व करें फार्मास्यूटिकल्स को और वो स्पॉन्सर करें इस चीज को, इट विल सूट देम आल्सो, क्योंकि हम उनको इंसेंटिव भी देंगे कि जो हमारे डेटाबेस में आएगा इसको जमा करने के लिए, हम वो जो प्रेस्क्रिप्शन है वो उसी के यानी कि दवाई वाले को भेजेंगे। आई थिंक इसके ऊपर हमें बहुत डिस्कस करने की जरूरत है। मैं रिक्वेस्ट करूंगा रवि आपसे कि AI फॉर हेल्थ के ऊपर आप एक अमना मलिक साहब से बात कर लें, जो लोकली यहाँ पे लोग हमारे साथ हैं, इसके ऊपर हम एक डायलॉग करते हैं, उसमें फार्मास्यूटिकल्स को बुलाते हैं, क्योंकि मैं समझता हूँ इसमें डॉक्टर हुमा इसमें बिजनेस भी है, इसमें लोगों की भलाई भी है, बड़ा विजन भी है। डॉक्टर हुमा, आई एम रियली थैंकफुल टू यू सिटिंग इन ऑस्ट्रेलिया, यू आर विद अस सो लेट नाइट। अब ये हमारी मदद कितनी आपको रखते हैं अपने साथ, बहुत शुक्रिया।
Thank you so much for having me here.
Thank you, Dr. Huma. Now I would like to invite my next panelist, Dr. Waqar Ali Shah from UK. He is a co-founder of Cheap.ai. Dr. Waqar, can you hear me?
Hello?
Yeah, please, we can hear you. Waqar, we can hear you. Please go ahead.
Yes. How are you all? I'm just trying to get my screen up. Just 1 second, please. Yes. So good afternoon, everybody, and thank you for inviting me. My name is Waqar Ali Shah. I'm the founder and CEO of Cheap.ai. We are a global healthcare AI platform, and we provide AI as a service to healthcare providers around the world. We're currently working with large private and public healthcare sectors in UK, the EU, and China at the moment. So I would like to share our platform with you guys. So if you can, I will just try to get up my browser. Please, 1 second, please. Just to give you a brief run through of this. So some of the services that we provide include drug discovery, cancer treatment optimization, and diagnostics for all kinds of cancer. Now I'm trying to get my web browser up so that you can view our platform. Unfortunately, I'm having a bit of trouble. If you can just hold on 1 minute, please. Can you see my screen or not?
It's not visible to us. Starting the screen, but not visible.
It's trying to open, but it's not visible now.
Can you see my screen now?
Yes, it's visible to us now.
So this is our platform. Can everybody see our website? I just typed it into the browser.
It's visible to us, sir. Yes.
Hey, thank you very much. Thank you. So Chief AI is a global aggregator of healthcare AI. And we source some of the world's best AI algorithms from around the world, including those for diagnostics, image-based diagnostics, those for accelerating drug repurposing, and a range of other healthcare-related algorithms. The system is based on a RESTful API, which means that it is a machine-friendly platform that can connect to any hospital machine. Whether it be a PAC system or a laboratory information system or any hospital information system can be connected through a machine interface called an API at the customer end. And on the supplier end, the suppliers can upload their AI models through a Python or R executable package. And these are then deployed to the hospitals. If we do a little search for something like cancer, system gives you a range of algorithms for such conditions as lung cancer, breast cancer, etc., etc. And if I were to search for lung cancer, you will see the range of algorithms that we have. So a hospital can then request access to these algorithms, and then these will be then provisioned to their particular information system. We also have a machine integration. So if you were to integrate, if you were to build a search functionality in your hospital machine, you could use our machine interface to just plug this feed in. You can copy and paste this feed in, and it will tell your basically it will tell your machine what is the most appropriate algorithm for the use case in real time. So this is another feature that's currently under development, but we have a trial which is for free on the website. So this is the concept of Chief AI, to aggregate all of the world's best AI, primarily in the healthcare sector, and then provide it in an optimized and intelligent manner to the consumers in the healthcare departments around the world, in the private and public sector. We also develop our own algorithms, the foremost being the breast cancer mammogram detection and the head and neck cancer algorithm, which we are currently developing and are in advanced stages of testing. This was a brief overview of Chief AI. And if you have an AI company, or if you are a developer of an AI algorithm, please do get in touch with us, and we'll be very glad to integrate your algorithm into our system. And we will be able to provide this to hospitals around the world through our platform. Thank you very much.
We'll have a lot of questions from you in the end. My quick question to you is, what is the medical authentication of your algorithm right now? Because again, when we deal with health, it has a lot of medical challenges also.
Sorry, could you repeat that? Certification, did you say?
What is the medical authentication of the algorithm we are talking about? Because, you know, we are talking about something, we are giving this algorithm to the doctors to understand something, or patient to understand something. So do you have doctors in your programming setup? What is the medical authentication of algorithms?
Yes, so there's two modes of actually deploying these algorithms. It's a very good question, actually. So the first thing is that a hospital would only be ready to use an algorithm for actually testing or diagnosing real cases if it was FDA approved or CE approved. So that is the only condition, to actually use an algorithm in a real setting. Otherwise, hospitals are often very eager to test algorithms in development with data that is not real time or is not real patient data or old cases that are not that are not applied in real time, but they can use the data that they have to help developers test the algorithms and not actually use it for a medical purpose. So these are two ways of doing it, and then that helps to get the producer of that algorithm in the pipeline for a FDA or CDA approval. And once it has received a CE mark or FDA approval, then it can actually be deployed into the hospital. So the hospitals and the developers collaborate, to get their algorithms to a sufficient quality level. And then obviously we are glad to collaborate and help bring those algorithms to the hospitals for this purpose.
Thank you, Dr. Ammar. Thank you. Thank you. Over to you, Rabia, please.
Thank you. Any other questions, gentlemen?
Thank you, Dr. Vakar.
You're welcome. Thank you very much.
I think no question. Now I would like to invite my speaker, Ms. Ammar Malik. She is founder of Women in Pakistan and president of Corporate, and now she is working on e-health projects. Over to you, Ms. Ammar.
Thank you very much. Assalamu alaikum to everyone. Can you hear me? Can you hear me?
Yes, we can hear you. We can hear you.
Go ahead.
Rabia, for my introduction, I'm pleased to be the part of Artificial Intelligence Center. Our think tank, Center of Pakistan and International Relations, also developed a Center of Artificial Intelligence with the collaboration of the Minister of Science and Technology, Ammar Chaudhry Sahab, and Special Advisor to the Prime Minister, Dr. Ammar, and also Dr. Taur Rahman, and also with Ammar Chaudhry Sahab. And if I tell you that in Pakistan is his vision many years back, and we all get motivation and inspiration from him. So I just would like to discuss what are our initiatives and how we would like to collaborate with all the worthy panelists who are here in this panel. We are the policy advocate of knowledge economy and fourth industrial revolution. So we believe in digitalization of health sector, and after this new pandemic issue, we believe that there is a world economic order, a new world economic order, and health sector is going to boom in the post-pandemic era. So we believe that training, financing, and mentoring of startups is something which is very important. And we are already working in this sector with the collaboration of CIT, and the CIT has already developed one app which is assisting those patients who are having issues of COVID-19, and they are getting the basic information and also linked to the important hospitals and doctors as well. So we are trying to align innovation with the need of underserved community. We would like to discuss that Sargodha division is an area where the Governor Punjab, Sabir Saab, appointed me to be the coordinator, and we are working on the health sector over there. So we would like to welcome all of you. As Dr. Huma mentioned, that there is an issue of data on which they can interpret. So I believe that we can arrange one tehsil level hospital in which we can provide you a certain data and we can start up one pilot project from there. And also the other colleague, Shah Saab, he also mentioned about his program. So we can also see that how we can collaborate in this regard. So we are keen trainers, mentors, but we are also interested to invest in AI sector, data science projects, also with use of machine learning, neural networks, deep learning to improve virtual diagnosis. Because now it's not possible for the doctors to reach the rural community, especially in Pakistan. So there should be some applications on which AI application on which we can access those patients to the doctors. I would also like to highlight that it's very important that this outbreak of COVID-19 needs to be stopped, and we need to work on the AI solutions, that how with the help of data analysis and analytics, that how we can control it, which area the government should work on the lenient lockdown and where there should be a strict lockdown. So these data analysis can really help the government to make the strategies at the district level, at the provincial level, and at the federal level. We are also pleased that our advisor on artificial intelligence, Dr. Sadiq Baloch, launched a very good project on artificial intelligence that is about detection of coronavirus through the X-rays and facial recognition. And that project they exhibited with the collaboration of NESCOM and Pakistan Engineering Council and Ministry of Science and Technology. So that is a pilot project, and they are also looking for investment. CIT is also having a health solution project. There they also require investment. So on this webinar, I request that Ammar Jafri Saab, I would really like to appreciate you that you are providing that network and connectivity on which the startups can pitch their health projects, the international companies can pitch their health projects, and the development sector and also the health sector can look at how we can collaborate. And people like us, like me and Ammar Jafri Saab, we can work as a connecting agent or a social agent who connect the right person to the right place. So I request today that we are starting a pilot project in Sargodha division, and we are thankful that Ammar Jafri Saab made it an initiative in the part of the Rural Incubation Centers program and also Digital Sargodha program. So now we called it Digital Sargodha Division Initiative. So we are looking at how we can collaborate in the health sector. There are certain recommendations at the end. I believe that our government should work on the national emergency, because this COVID-19 is something which is creating a lot of hue and cry. And I believe that it's very important that we should work on the national, from the perspective of the national security, and the government should work on the national emergency, so that we need to control this pandemic. And here there are worthy doctors, they can also recommend. I also believe that we need to invest on the research and development in the health sector in Pakistan. Here we can also collaborate, because we are already working CITs and institutions where we are connecting the startups with the investors, but we are also looking for, we can also provide the platform of the other universities where they should work on the health sector AI startup programs, and we should encourage them, and maybe we can find some connectivity. In COPARE and in our Center of AI, we are having very good fundings for the health projects. If students pitch why Ammar Jafri Saab, we can work on that. That is something which I'm looking forward that Rabia Kamal is going to play a very important role. I also would like that it's very important sometimes in Pakistan to develop an awareness campaign. Our basic nutrition, our basic health facilities are not good enough. Like we need to improve that. And we need to work on the health sector. And we need to talk about, it's very important, an average female and average child in Pakistan is not having the basic nutrition which are required. And then sometimes people are not aware of many of the health issues, like in COVID-19, despite government and media a lot of support, many people were not aware of it, and when they face this issue, then they realize that what they have lost already. So finally, I believe that AI can complement human intelligence. I believe nothing is better than human intelligence. So AI can be the part in it, and we should work together to make a effective, health efficient system of Pakistan. And anything if we can do to our worthy panelists from the other part of the world. So we would like to introduce you to the right sector and to the right place, because you require the data to work upon, and to use the algorithms on that data and to guide us further. So looking forward that this is going to be a series of seminar, and I'm really looking forward that how we can have one pilot project in Sargodha division, and or one of the district of Sargodha division, like I belong to Kushab. So we can work in Kushab. I have already talked to the district health office over there, and also to the medical centers. So we can see that how we can collaborate. And thank you very much, Ammar Saab and Rabia, for giving me this opportunity. Thank you.
Uh, thank you, Amna. Like always, you're forward-looking, always looking at the future. I'm so thankful to you. CEO Stella, the speaker, is also with us right now. So I think you have got a wonderful roadmap for Sargodha division. And if we can establish some center of excellence in Sargodha or Kushab, wherever you like. Dr. Budud is sitting here. He's heading the CIT Health Solutions. Shah Hassan is here. So with all this, I think we are talking about the ecosystem. Nobody else better than you knows it. My passion for the last 10 years to make
Yes,
all
I am
this
the
happen.
witness.
You are the witness to it. So whatever I used to say, I'm practicing right now. You rightly said we need to engage our students into it. Tomorrow morning at 10 a.m., I'm having a very big seminar with the Islamic International University, where the rectors and VC will be there. I send you an invite, you can join it that also. So what I'm trying to do it, I'm just trying to excite the dean and lecturers and professors there to please engage the students in their FIPs for such projects. You know, once our students in 7th semester, 8th semester try to understand the real value of their project, I'm sure job will be done. Because the future leaders of AI in health are right now in universities. They're not in the open markets. The future leaders. Thank you very much. Again, over to you, Rabia, for taking the step. Please, Rabia.
Thank you, Ma'am Amna. Now I would like to take my next panelist, Dr. Usman, Assistant Professor and Digital Health Consultant, Taipei Medical University, Taiwan.
Dr. Usman, thank you very much from Taiwan. We'd like to listen more from you.
Thank you so much for having me here. Mark Jaffrey, I heard about you from Rehan Allahwala, and you know, I went through a lot. And actually, I've been visiting Pakistan for last couple of years, and whenever I give talks in King Edward or Sheikh Zayed or other Khan, so I always try to talk about the digital health. But as you know, you knew that the physician and we don't have so much the things in digital health. So people are, you know, like what we are talking, computer, you know, there's nothing important at that time. But now everybody is talking about technology. So I have a few slides to share, and it's very interesting discussion. Started with Dr. Homa, and the things I can share, like, you know, how we have done the projects in different countries from the resource settings. Let me share screen.
Yeah, I guess. You are waiting for someone to switch on your screen? Ravi, are you there?
Yes, sir, I'm there.
What is the problem with Dr. Usman?
Just
I
keep
think
going the
जी चेक करो अपना नफीस चेक करो उस्मान साहब क्या प्रॉब्लम हो रही है
तो स्किप हो गया सर आप किसी और पैनलिस्ट को ले लें वो दोबारा रीज्वाइन करेंगे तो देन
आप
सर वो हो
डॉक्टर
रही
बुजुर्ग को ले
जी
ये देख लें अपने शफीक साहब होंगे शफीक साहब हैं शफीक साहब आर यू देयर जी उस्मान साहब आ
Hello.
गए उस्मान साहब जी उस्मान साहब सॉरी आप प्लीज गो
Um, can you see my screen?
yeah no, we cannot see your screen we can see you only yeah now it's there okay fine
Okay. Okay, so today's topic is very interesting. So I will just go through quickly because we have only a few minutes. So I have been part of this digital health for the last 10 years. We're working in Taiwan, but I was in collaboration with MIT, with Howard University. We were having different projects around the world. And myself is also fellow of Health Informatics College from Australia, Health Services Management. So you can see I have a very versatile background with healthcare basics and then health management and then health informatics. So we knew that, you know, the data has a value. You can see that Google is generating a lot of data, Facebook and Amazon and a lot of information. And, you know, that if we take only one social media like Facebook, they have a lot of other connected social media, which generating a lot of information. So what we are thinking is, you know, providers, they usually provide the care to patients, and then this information is collected by electronic health records. And then it is used for, you know, the basic biomedical research. And then these are different kind of registries like national or, you know, local. And then from that information we use for standard prevention and treatment, and then we create some protocols. And then it comes back to the decision support systems, which usually help physicians or pharmacists rather, you know, to make some decisions. Because we assume that the doctors, they are also human beings, so they cannot have all the information on tips. So they need some computer assistance as well. Why Taiwan is playing great role in this? Because they have a good ICT infrastructure, and they were having the whole nationwide, you know, the computerized system, health information system, and all the hospitals and clinics are linked to each other. And, you know, the average person in Taiwan, because the total population is only 23 million, which is equal to the Karachi population actually. But they were having the, you know, one person is visiting per year 15 times to the hospital. And all the drugs and the disease scores are, you know, coded in by physicians. So because we talk about the data quality sometimes, which is also, of course, and accurate prescriptions, of course, and very data structure standard. So because it's a like a huge amount of information. When the patient is going to see a hospital doctor, they will have maybe at least two diagnoses, one diagnosis. At the same time, some patients have diabetes and hypertension and sometimes other diseases, but they have multiple drugs as well, sometimes 10 drugs, 15 drugs. So you can see how much information they're generating. But if this was a study which was saying that in US, the top leading cause of death is medical error, not the heart. You know, the heart is, of course, cancer, but there is also medical error is on the top 10 too. So it's not just because of the diseases, but there is a medical error as well. So based on the data, we try to generate AI model, which is we call advanced electronic safety of prescriptions. Using this data and association model, we use AI, and we try to see the results, which were agree. For example, 75%, 90% were agreement between the samples we give to the physicians or the pharmacists, and we compare the results with the machine. So you can see how much it was comparable. Because you just mentioned about that, you know, the algorithms we are using in healthcare are need to be very safer and should be approved, you know, like FDA approved or other. And that's why we need to keep in mind all this kind of information. So this data is also generated for the cancer prediction model. For example, like, you know, we, based on the data, we usually build the models to let the people know that, you know, you may have this kind of risk to develop lung cancer, liver cancer in next 3 years or next 2 years. That could be not only beneficial for prevention, early prevention, but also for insurance companies or for other lot of different things too. But also, of course, because the countries like which are paying for a lot of money for the insurance, the government insurance, they can have these kind of treatment plans beforehand instead of spending a lot of money on the cancer drugs as well. So based on the data, we also try to generate some kind of this visualization. You can see here, it's a data, a healthcare data, which can let the people know that, the physician or researchers, that if you have one disease, how many other diseases you can have associated to each other. So they can see, for example, if someone is going to have diabetes, more likely they will have to, hyperlipidemia in maybe next 1 year. So there are treatments, early prevention too. And you can see here, there's a disease map. This is like a galaxy map. So the different color shows a different system of the diseases. The size of the ball is showing that how much is the population with this particular disease, with this particular age group. If you can see here, there's an age group they can choose. They can choose the disease as well, the disease name or disease code, and they can see that how many people are along each other. For example, if we are only interested in male 50 to 59, we can choose here and we can see if there is one disease, what are the other more diseases more closely to each other. So the gap between the balls is showing that how much they are interrelated to each other, and the colors are showing the different systems too. So it's a very interesting, and also for the learning and also for the different purposes to understand better the data. And also this is the disease spectrum, because chronic kidney disease is of course is a big burden too. People are spending a lot of money on dialysis and stuff. So we also developed some kind of visualization tool to see the pre-CKD people, what kind of other disease they had, and what are their risks of mortality, like and the survival chances and other kind of diseases too. So based on that, we can have the treatment plans for them too. Because I also heard about the data for the image data, which is very important, because for COVID-19, there are research going on that we use CT scans and X-rays to predict the COVID-19. And we are also doing here, of course, because we are generating a lot of image data as well. But besides that, we also have this project, which is also a startup company now, that we just use the app and take a picture of any mole on your skin, and it can help to predict up to 90% that, if this is a melanoma, skin cancer or not. So it can give you an advice too. And this is also FDA approved. And we are working on the trials with the US too. So this is still in the process as well to get approval from US. So it's already Taiwan approved here. So you can see this is just, the basic thing is early prevention. Sometimes people don't care about the moles and they think that, it's just a normal, but some of the countries, they really have this big issue. For example, like in Australia, there's skin cancer is very common there too. So some of the examples of AI, for example, in Taiwan, we use, I told that everything is centralized system. All the data is in the National Health Insurance database. Like we have another, we have other kind of systems. But this is, you can see how the data is going to the National Health Insurance, and it's all linked to each other. For example, if you're going to one hospital in one city, if you're going to visit another city, another hospital, the data can be check, you can see what patient has been taking the medicine or what kind of treatment they have and stuff like that too. It doesn't mean that they all are using the same softwares. Of course, they can have the different, but there are some bridges which, we try to make to have the data too. Besides that, we also have developed the NHI in Taiwan. They have the application, which is called My Health Bank. In My Health Bank, we are trying to empower the patient to have their own information. And now the people will ask, what the patient will do with their own information because they don't understand their information. Of course, but there are some kind of visualization. There are some kind of information, for example, like public health awareness. If somebody has a diabetes, we can, give them some reminders, some prediction model. We can tell them to exercise, to maintain diet, and, many other things. But one of the interesting thing Taiwan has done is that they introduced one feature called e-mask, because there was a lot of challenges and how you can control the people to buy the mask. So they introduced the one feature that the people, they don't have to go and queue in the pharmacy. They can just buy online using their app and account, and it's safe and secure. So from there, they can monitor which people, how many people are buying how many. So they only limit 3 masks per week. So you cannot buy more than that. And they can see your, all the data as well. And they don't have to be waiting in the queue for one hour, and also to avoid from the infections too. So this was also a very interesting feature introduced, and everybody have access to the devices too. And also the one of the best example they did here to how they control this COVID-19 is that they link the immigration data with the national health insurance data. So for example, you know, it's a common thing that the patients, when they feel a fever or cough, they visit any hospital, they will not disclose that when they where they will be, they were visiting, you know, maybe in Thailand, Japan or something. So then the physician, when they're using the card, it will automatically retrieve the information about their travel history, that where they were last time, you know, last week or last 2 weeks and stuff like that. So even they are not disclosing to physician, but the physician will be able to know. So this is a good thing, that how they control. And so it was must to quarantine, you know, for 2 weeks if they have visited or they having showing some symptoms too. So this was one of the good initiative too. And also there was a study we also published from our group is about the application of Google search. So they see that what kind of people were searching on the Google trends about the COVID-19 during this thing. Of course, because, you know, a lot of data is generated throughout. So there are some examples, like people are using some games where, you know, they can have the different kind of structure for the vaccines, or, you know, some molecules of the drugs about COVID-19, which is very interesting because people will like to play, and they can also able to build some new model. And WHO also introduced the chatbots, which can help to provide some information, some learning material on COVID-19 too, of course, based on AI as well. And for telemedicine and other health tech solutions, we are also working with MIT for the last almost 10 years. We were having hackathon, datathon events, you know, in different places, industry and academics together, where we invite all kind of people, including all versatile backgrounds, because we don't want to limit. And this is actually the multidisciplinary field where we need all kind of people with the different backgrounds too. So in these kind of events, we also have a startup companies, the projects who will be on the top list, we encourage them, and we, you know, we also let them know that, you know, where they can access the funding and stuff like that too. Besides that, we have the telemedicine, the projects in Africa and other countries. The thing you were mentioning about is, like, you know, the clinics. I saw there are some, sorry, there is a noise coming from somewhere. I saw in Punjab, I visited some of the remote clinics. I think they have already given them the tablets now, and the tablets can be used to have the data and the centralized data, because we have open source tools as well. And we have developed these kind of tools for resource poor settings, like in Africa, where we have provided the tablets to the healthcare workers when they were visiting village one-to-one. Like, for example, in our country, we can use this for vaccination, because we have a problem that how they have to, the healthcare worker, they have to have the paper records, and later you are visiting the same home, or maybe sometimes skipping the other home. So we can have solutions for that on just using the simple tablet, having open source. They don't need to have a 4G data as well. If they don't have internet, it's okay. It will work, because when they come back after the data, they can just synchronize in the same in the main office where there will be the internet available too. All the data will be secured as well, and it can be accessible to those who are in the admins, physicians, or nurses, or, you know, some of the healthcare workers. And those solutions can also help to take, you know, if you are taking a picture of that particular patient, it can pop up that, you know, whether it was registered before or not, along with the name and, of course, other authentications as well. So what I mean to say is there are cost-effective solutions to collect, to have a lot of different solutions. So besides this vaccination, malnutrition case, and other kind of solutions, there are some kind of things which can be done here. For example, in the general clinic and remote clinics, where we can design just using the simple HTML program, the kind of software where the physicians, they are putting their diagnosis, drugs, and all the history, and all the data can be centralized and linked to each other as well. So if you heard about the MIT Sana, which was built from MIT, it's called Sana. I think it's here, the logo is here too. So that was the mHealth telemedicine we were working on the settings for this open source tools too. So nowadays, I think we also have a problem with infodemic because social media, all the information is available too. But we also use this infodemic, the social media information, for people's safety, and to see that, to predict the suicide attempts, psychological impacts, and, you know, some drug adverse events as well. So this information is also as well very helpful. So besides that, you know, tech companies are coming into healthcare. Of course, IBM Watson has introduced the oncology program, which we have implemented in our hospital, and we were doing the clinical trials on that. And you can see the Apple, they also have to introduce some kind of, care kits and other. You also talk about the health IoT. Of course, I second this one too, because we also developed the sensor, biosensor here in our lab, which is very useful because we can monitor 24/7 the people, because we cannot accompany people all the time. So we need to monitor the people's daily health routine as well. So these are very useful. If we combine all this kind of information, we can build some kind of prediction models and also help them to have a healthy lifestyle. So the current scenario is like, people, if they're riding the bicycle, they can have the trackers, all the information is tracking, wheelchair, we can have the fall detections. The people in the hospital wards, we have developed some kind of voice control using the Google and Alexa, where the patients who are admitted in the surgery ward, if they cannot move, they don't need to have an attendant all the time, because not everybody can afford the attendants all the time. So they can just control from their voice, the lights, curtains, and everything, turn on, off, and it's in different languages, which we have implemented in the US as well. It's going on in trial too. And so the current scenario is we're already having mobile phones, some Fitbits and other kind of things, and all kind of information can be collected. And sooner, I think we are going to have even the smart homes, because in homes people would like to have a sensors. Actually, we are having now as well. In some countries, you can have your garage closed from your mobile app, your car, your lights, and all kind of stuff too. So this will be, changed. This is just a free course on Future Learn we are facilitating. We just had a last session, and this is a new AI and big data in health, in global health information. Anyone interested, feel free to join it. Yeah, this is all from me. I'm open for the questions.
Dr. Osman, is really mind-boggling, really mind-boggling. You have just the machine gun of information, and you were just bullets coming out. It is very, very amazing. And I'm very happy to see the young people like you who belongs to Pakistan, and they are doing something very amazing. So Amna, I think it's the right time to, what I could see with all my experience. The information, the knowledge, what Amna said, knowledge economy, is coming like a bullet from a machine gun. So we in Pakistan have to first two things. One is to create awareness, absorbing anything what you and the speaker before you have told, right, from Dr. Ruma and everybody. It is very, very, people are here fighting for the day-to-day activities. The doctors here, they're surviving for their job, it's their life. But this is something very important, that we have to carry all things together. To my understanding, the best resource right now is in the universities. If we build their capacity, because it is their bread and butter of the future also, is a career also. So I think, Amna, we should think about it, that we should try to engage the young students, the entrepreneurs, to start their startups in the health sciences. And Usman, we need people like you. Maybe you have to walk an extra mile to serve your country. We cannot commit anything practical with you right now, but I'm sure if we do something collectively for this cause, health for all, something like this. We work on SDG 3, which is again focusing a lot on health services. A lot of people in this webinar right now belong to SDG groups. So we can think big, and the initiative Rabi has started, like AI daily at 8 o'clock. I think we'll be daily discussing a different domain. And Usman, thank you very much. Maybe in the end, if people have some question, over to you, Rabi, please.
It's my pleasure, and we also need people like you to motivate us and provide opportunities to contribute as well. Yeah. Thank you.
Please go. Rabia, please go ahead.
Thank you, Dr. Swan. Very amazing talk. Now I would like to invite my next speaker, Mr. Shafiq Ammar, from Stella Health Technology Company, USA.
Before Shafiq talks, let me tell you one thing. Shafiq is a very good friend of mine for the last so many years. And he's an amazing person. I mean, when this problem came, and I started to educate the Islam police for the COVID, how to combat. So IG Saab said, okay, first you provide us the facility. Shafiq came forward. He actually offered everything free for all. When I invited him, he was very kind to come to my residence, and he said, Ammar, it's not time to earn money. We'll earn money later. Shafiq, I'm really thankful to you. You are cooperating a lot. And I'm not very interestingly, whenever I invite, he's so busy person. He's working in 23 countries, so busy person. But whatever I request him is there. Thank you, Shafiq. I cannot pay you back in any point. Thank you. Thank you.
Very
Thank
nice.
you. Good to hear Usman and Amna and everyone and Ammar Jafri sahab as well. So yes, can you hear me?
Yeah, we can hear you. We can. Please go ahead.
Okay, so I'm just a student in front of you guys. So on AI, actually started a couple of things different initiatives few years back. Like AI, I can tell you in simple words, like you cannot do anything until system is going to learn something. So if we talk about the layman example, so during COVID you might have noticed everyone, either women or men, they are now professional chefs in the COVID-19 and lockdown. The reason behind that is they all learned from YouTube how to make different type recipes, different type of things. You can see everyone is posting like like 4-year-old can make pizza and 70-year-old can make anything. That is all because of the data being sitting on the YouTube and on different things as well. So what we started a couple of years back, we have seen 3 problems in the Pakistan. Like we had machine learning and AI built system for the US, but when testing in Pakistan, that was totally towards the failure side. The reason behind that is like our diets are different, our social circle is different, health is different, and allergies in Islamabad are different, Karachi is different. So you cannot actually predict something which can like you can guarantee you are going to cure something. So that's why actually what we have seen in those 3 areas, like one was the mother and child, second was like how we can actually build a system which can, like, there are 60% people who are going to the doctor, they should not go to the doctor, but there are 40% patient who needs the doctor. When they go there, they see doctors schedule busy or long queues, and they come back and they get critical. So this is the second problem which we were trying to solve. And third one is the like there is you might see 100,000 doctors in Pakistan, but people prefer to only 1,000 or 2,000 well-known physicians who they believe they can treat them as well, and they can actually diagnose something. And reason behind that is we wanted to actually build some kind of system which can learn and which can provide best practices, no matter it someone is sitting in the tier 3 medical university or tier 4 rural areas as a doctor, or someone is sitting in the Aga Khan. They should both can actually treat the patient in similar ways. So for AI, like what we have learned, major issue is like how you have to grab the data and how you have to actually make use of that data. And I would say like during our learning, like for 2 things, like one is the blockchain, one is the AI. Both, if you here you can actually learn lot about them, like this can solve this, this can solve this. But when you go into the reality, actually you see a lot of challenges. And we always started like what cannot be done through AI and what cannot be done through blockchain. And that was our like driving force to reach at least at some level where everyone can benefit from there. So I can give you an example of the mother and child, one segment, because of the time limit. Other than that, we can actually provide information whenever it's required. So I personally, actually, I was visiting Thar at that time when everyone was going and everyone was worried, like people are dying, and 11 different NGOs, they were actually providing drugs and different things, and even doctors were there. Even Chief Justice, he visited, like he have seen a lot of facilities, but no one was able to get what is the issue, like why like still a lot of kids are dying and other things. So when we actually spent 2 weeks there, we have seen like everyone is providing drugs and other things which are not required to for that problem. Actually their basic need is there were three different problems. One was like early child marriages were there, and second one was like nutrition were not at that level, so you have to provide the nutrition to the mothers and during the pregnancy. And third one was like you have to bring them at like health seeking behavior as well. So either you can implement different systems and you can rely on those population and people, which is like you cannot do it. So what we actually did, and we are in the testing phase, Dr. Usman was saying, on the sensor base. So we are actually working on the tests how we can monitor that mom from like after third month through the chip, GSM enabled chip, which is actually monitoring through it's similar like a Sunny Plus. You just put there and it is monitoring fetal and heart rate and temperature and other things as well, and it is collecting the data, and it is going to send to the gynecologist as well, and LHWs as well. So they can actually monitor during like 9 months for that mother. They can monitor that, and they can actually assist, and they can provide the data to the healthcare professionals and NGOs and other stakeholders to work on that. And after that, once child is delivered, then actually same chip we are using for next 24 months as a band to the kid, so you can actually monitor the nutrition of that baby as well. So this is what we are actually based on, like physical learning. And on physical learning we came and we developed some algos and other things, and we are working on different sensors. Then actually we are going to put in trials, and we will see like how it is giving the results for like very backward areas. Then actually we will move towards the tier 2 and tier 1 areas as well. So this is in limited time I can tell you what we are actually in the very early stage. So anyone, if anyone has questions or anything, we are happy to answer in that.
Nisha, I have a quick question from you. You are talking the cutting edge technology in health sciences because you have a long experience of working in 23 countries. You are based in the USA and you understand this very well. How do you comment on the appetite of our doctors in understanding these technologies, not at the professional level, even understanding it through the using them, and then accepting it? Because my worry is 10 years back when I talked about e-health, nobody listened to me. Dr. Vudu is sitting here, he's working with us in CIT for the last, I think, 8 years. People used to laugh at me. When I used to talk, let me tell you a record. A medical doctor with 30 years experience, he actually laughed at me. He said, Ammar, what the hell you are talking about? Doctor sitting in a village, in a city, seeing a patient in a village. So I still remember I said, my dream is so big that if you would not have laughed, I would have made my dream bigger. So today I see my dream coming true, like you said. But Shafiq, since you belong to Pakistan and you have the same pain which all of us have, Amna has, me has, everybody has, how would you help us? We will be your front soldiers, let me tell you. We'll be your front soldiers. We'll go to doctors. Amna the politician, she goes to that division. We'll make your moderators go that division. But how would you convince us, an ordinary MBBS doctor, practitioner, to accept all these apps you're talking about and to do whatever your requirement is?
So just to add on that, so like 2-3 years back, because we were working since 19 years in different countries, but 2-3 years back when we started in Pakistan, so we visited different doctors, different teams, and we got similar type of attitude which you are talking about, like from different type of doctors. So we just observed them, and we actually came up with all the excuses which they were giving for not accepting the system. So I can tell you a couple of them, like they were saying, we can talk with assistant and patient, but we cannot use the system, and we don't want to be data entry operator. Other excuse was like they were comfortable more in the handwriting instead of going and on the systems and doing the entries and other things. Third thing was they were saying we are look, we are checking 30 patients in a day. If we use system or other different complications, we might lose the revenue side as well. Like we might see only 15 or 20 patients. So what we did, we actually provided them like similar. We asked them, you can talk, no worries. You can talk instead of talking with assistant or with patient, you can talk with system, which we enabled as a speech to text as a Google Assistant level. So you can actually talk with system and both purpose will be solved. Your digitization will be coming on the system and you are not going to change anything. There is no change management. Other than that, for prescriptions and other records, what we did actually, we enabled handwriting in digital pads. We asked them, you can write, but don't write on the paper. You can write it on the digital pads which we are providing you. So your prescription still will go as a hand prescription. And on other side, on the time consuming and revenue side, we run the different cycles with doctors. We told them like you can check patient today in manual way. The way you are checking, it might take 15 minutes for checking the patient. After 30 years it will remain same, it will take 15 minutes. But if you go on our system, we can guarantee you from day one it will take you 25 minutes or 30 minutes, but on a very next day it will take 7 minutes, because of we are collecting a lot of prereqs and the regular data which you are putting for almost all patients. You can actually have save data templates and favorites. Most common system is learning, and it will help you in the improving the productivity, and it will give you something which you can. And on the manual way, it takes them like sometime days, sometime hours, sometime they are not able to find the record if patient is coming after 3 months or after 2 years. But on the digital, they can actually in 10 seconds they can search the record and they don't have to do the repetitive tests. And on other side, like both patients and doctors, because of the telehealth, normally doctors, they don't go on vacation or they don't go anywhere else because they have a fear they might lose the patients if they are not in the clinic or somewhere. So through technology, actually they can go anywhere and they can see patients, and they can have follow-ups as well. And I can tell you, like even before COVID it was coming, but after COVID you will see like lot of consumer patients and everything. It is going to happen in similar way. Like if you look into the grocery stores or different type of stores, 30 years back you used to go in different stores, but now even you don't go on stores who has a less counters because you don't have time. Like if there is no barcoded system implemented on any, don't go, you don't prefer to go there because it will take time and other entries as well. You always prefer which store has a multiple count or different levels. So in health or health, it is going to happen, and people will be worried on the time and better care and other things as well. And it's going to be actually more on the knowledge side as well. It's because in last 5 years, everything information has been floated. Now everyone is actually gaining the knowledge, and they will have a better decision to actually select the doctors, physicians, and specialty wise based on the ratings and other things like and other digital players like Kareem, Uber. They already actually brought the people at that level. Like they can be like anyone can use the system if you are connecting those systems for their basic needs. I hope that answered the question.
Slogan, slogan.
Thank you,
Very
Dr.
good.
Shukr.
Very good. Rabia, please go ahead.
Thank you, Mr. Shukri. Now I would like to invite my last panelist, Dr. Faisal Wadood, from HOD in CIT Health Department, Islamabad.
Dr. Faisal Wadood is with us for last 8 years. He's a wonderful person, otherwise, and he's very close to our heart. He has a passion. He has a passion. And let me tell you one thing very interesting about him. He sings very good also. So whenever we have some functions, he sings also. Over to you, Doctor. Over to you.
Thank you very much. Assalamu alaikum. I am Dr. Faisal Wadood. and I am currently serving as the head of Department Allied Health Sciences at CIT Islamabad. Basically, I'm a medical doctor and a traditional medical doctor as that, specializing in public health. And I've been at CIT for more than a decade now, teaching public health and allied health sciences. I feel extremely honored to be a part of this group because I came here to learn and I learned a lot. And I will be looking forward to learning a lot more about the integration of artificial intelligence in our public health sector through the expert advice of the respected panelists and respected members of the groups, because you are the experts in the field. And I'm just a student of this. As you know, public health is a very complex branch of medical science because we deal with complex health systems and large groups of people. There are two parallel systems of healthcare. One is the individualized healthcare, that is the traditional healthcare, that focuses on a person, individual health needs, that the other panelists were very informative about. And but public health, on the contrary, deals with large groups of individuals at one time. You know, we deal with the community, and that's what makes it more challenging. And also, that is the reason why the interpersonal skills, motivation, monitoring at a human level cannot be overstated in public health. However, there is no denying that recent advancement in technology is now the norm. You know, it's the name of the game. Artificial intelligence has emerged as an extremely useful tool in public health, and a lot of it is being utilized throughout the world. In Pakistan, we have a very developing healthcare system with very limited resources and very grave challenges. One is happening just as we speak, the COVID-19 pandemic, where you can see public health in practice. You know, that's what we do. That's our bread and butter, what we are faced with in our daily practice of public health. So what we are observing is we are already utilizing some tools of artificial intelligence in our public health. For example, there's a need of real-time data processing across an entire spectrum of a country or a region, or in this case, in COVID-19, the whole country. That is happening. And we are sharing data with different communities, with different countries, you know, one continent to the other continent, monitoring the day-to-day, developments and the behavior of the disease, the pattern of the disease. And then this also, artificial intelligence is also aiding us in coming up with predictions about how a disease is going to behave. For example, today we have 100,000 patients in Pakistan. What will be the figure after 15 days or after 30 days? You know, this data helps us predict the behavior of the disease. It also enables us to, you know, make fast and accurate diagnosis. And artificial intelligence and the newer technologies, these are helping us, you know, in assessing, in determining the risk factors for a particular disease in a particular community, which also in turn helps us to plan appropriate and timely interventions. Needless to say that the final importance of this in public health is the public awareness and bringing the correct information to the target audience that is being affected by a particular disease. So I'll be looking forward to learning a lot from the professionals in this field, the respected members of the group, and how to integrate artificial intelligence in a developing healthcare system like a country in Pakistan, which is faced with enormous challenges ahead, with limited sources, and there is a growing need to integrate artificial intelligence in our system. Jafri sir.
Thank you, Mike. Thank you. Thank you, Dr. Saab. You have been, like always, very, very informative. And since you are the hands-on, so I think you are the best person. So, ladies and gentlemen, actually, I was looking at the questions, and I think majority of the questions are that how you would integrate all these technologies with the people living the grassroots. Because people say, and I'm just looking at the question, that in Islamabad, Karachi have got the best facility. That's it. What about people in Miawali? What about people in remote location in Khushab? So it's a big question. And Ammar, I would like you to respond to this question. The big gap. It's a big gap now. There are available technologies. You can see experts with us. They have the applications. Tell us the applications. Usman has everybody is telling about it. They're like a pyramid. At the top level, we have the experts. At the middle tier, the doctors are sitting. At the bottom of the pyramid, there are patients who are not ready to accept this. So, as you have figured out about solar division, if I request you to take this information to the doctors, so would you be able to bridge this gap? Over to you, Ammar.
Exactly. I think I agree with you. And Ammar Saab, what I mentioned earlier, we need to play a role of a bridge. Uh, and we need to develop a network of academia, doctors, and these IT consultants, and also the local hospitals. So, we can play the role of a bridge. And I think today's seminar, our conclusion should be that we are the facilitating agents, me and Ammar Saab. We are going to provide the network and the basic, project, and then they can see that how they can collaborate. We can also find out investments also later on if somewhere required. And but we are the one who are going to play a major role. And I am really very happy to see our Pakistanis who discussed different health projects. So inshallah, they will also come forward for helping their own Pakistani community. And slowly and gradually, I think we can move from one district to another, and we can help people with the ideas of other fields.
Thank you very much. And I think all questions have been answered by the panelists, especially Shafiq answered the questions written here, how you will club all these things. So in the end, I'll thank all the panelists. I know that it's very late. People have to pay their dinners and everything. So people are different countries, they are watching us, I could see. So thank you very much. So I think it's a great day. The video is live now on our website, and we will have this recording also. I normally think that this knowledge which has been expressed in this last 2 hours, I think is a sea of knowledge. Our students should see it, our teachers should see it. They should have a better understanding of all these things. Then these things be translated into some small video clips or audio clips. Tell to the students, okay, this is a product, it has been made like this, and you do it on this. So the extension of knowledge economy, then they will continue. So if anybody want to say anything in the end, I'm ready to, please go ahead and switch on your speaker and you can say anything. And in the end, I would like to thank a very important person. His name is Shah Hassan. And Shah Hassan is actually managing the everything around. Shah Hassan, can you speak for a minute? I'll be very happy to listen to you. Shah Hassan, can you switch on your mic? And Nafis, can you bring Shah Hassan?
I allow him, but he's...
Actually, Shah Hassan is in some remote area and he has some serious communication problem. So, but let me bring on record. Shah Hassan is doing a wonderful thing. He works, I think, 18 hours a day on CIT Health Research.
Assalamu alaikum, sir.
Oh, Shah Hassan, I'm happy to see your voice. Please go ahead. Please go ahead.
Thank you, sir, for your support and mission. सर सबका आपका बहुत बहुत शुक्रिया और बहुत नए चीज़ें की मुझे सीखने के लिए ये भी मिली और इंशाल्लाह अभी जो हम कोविड-19
हैंड फ्री प्लीज आप अनप्लग कर दें, देन आपकी आवाज़ सही आएगी शायद से।
जैसे वीडियो बंद कर दो बेहतर आएगी।
जी अब बेहतर आवाज़ है।
तो सर CIT हेल्थ सॉल्यूशंस डिफरेंट कोलैबोरेशन कंपनी के साथ काम कर रही है और कोविड-19 पेंडेमिक में हमने स्टेला कंपनी के साथ मिलकर पाकिस्तान के डिफरेंट डॉक्टर को ऑन बोर्ड लिया है, जिसमें वो अपने घर से बैठकर पेशेंट के साथ टेली मेडिसिन के जरिए उनको गाइड कर रहे हैं, उनको कंसल्टेशन दे रहा है। तो ये सर बहुत अच्छा अपॉर्चुनिटी है कि हम टेक्नोलॉजीज को यूज़ करके पाकिस्तान के जो हेल्थ इश्यूज है उसको हम सॉल्व भी कर सकते हैं और कम भी कर सकते हैं, और हम इसको कोलैबोरेटिव इस पर काम कर सकते हैं। और इसके लिए CIT हेल्थ सॉल्यूशंस इसका मेन थीम यही है कि हम डिफरेंट कंपनियों डिफरेंट ऑर्गेनाइजेशंस के साथ मिलकर हेल्थ के टेक्नोलॉजीज बेस्ड सॉल्यूशंस पर काम करें। तो मैं सर आपका भी शुक्रिया अदा करता हूँ सब पैनलिस्ट का, और एनी टाइम मैं अवेलेबल हूँ। जिस तरह हम इसको आगे ले जा सकते हैं इस वेबिनार से आगे कि हम प्रैक्टिकल और भी इस पर काम करें AI के थ्रू। बहुत शुक्रिया सर।
थैंक यू शाहसन। एंड में रबिया का शुक्र अदा करना चाहूँगा। दिस वुड हैव नॉट बीन पॉसिबल अगर रबिया देर रात ना काम करती। कल इसका आखिरी मैसेज रात 1:30 बजे आया था मेरे पास। देखें, मैं बड़ी सिंपल सी बात बताऊँ, कभी भी एक शख्स या एक इदारा काम नहीं कर सकता। मैं सुबह से, ये मेरी 5वीं वेबिनार है, मैं बहुत खुश हूँ। इसमें कुछ हमारे यूनिवर्सिटी के लोग भी बैठे हैं। साथियों, ये मुल्क ठीक करने के लिए हमें किसी एक इदारे की जरूरत नहीं, हमें सबको आगे आना पड़ेगा। ये मुल्क हमारा है, हमारे आने वाले बच्चों का है। हम जज्बे से काम करें। और मैं सबको बता रहा हूँ कि 14 अगस्त के लिए मैं छोटे से बच्ची की तरह चीज़ सोच रहा हूँ। आई एम वेरी एक्साइटेड अबाउट इट। मैं जल्दी शेयर करूँगा आप लोगों से इंशाल्लाह। ये जो रबिया ने रिसर्च शुरू किया AI वीक का, इस तरह बाकी वीक्स आएंगे, ब्लॉकचेन वीक्स, IoT वीक्स, SDG वीक्स आने वाले दिनों में आएंगे, हम शेयर करेंगे। आप सब लोग का बहुत बहुत शुक्रिया। लुकिंग फॉरवर्ड टू सी यू टुमारो एट 8 PM। क्या कहते हैं आप रबिया? 8 PM विद रबिया, 8 PM विद। थैंक यू जी, बहुत शुक्रिया। थैंक यू, टेक केयर।
Thank you. Allah Hafiz.
Thank you all participants and panelists so much.
Thank you.